In this video, we're going to talk about T-wave inversion. In particular, we're going to talk about T-wave inversion as it relates to cardiac ischemia. I do want to preface this by saying that cardiac ischemia is not the only cause of T-wave inversion, but in this case, we're going to talking about specifically how cardiac ischemia can cause this finding on the ECG. So there are a number of pathological and non-pathological causes of T-wave inversion. We here are specifically talking about the potential for cardiac ischemia to cause these inversions. So to understand that, what we're going to first talk about is the normal ECG and how this relates to depolarization and repolarization of the heart. For the most part in this video, we're going to be talking about the T wave. So our primary focus here is going to be on the T wave. And it's important to remember that the T wave represents ventricular repolarization. So the T wave represents ventricular repolarization, which is going to be important when we're talking about repolarization versus depolarization in terms of the flow of ions. So what I'm going to do is I'm going to draw our lead in here. So when we're talking about the flow of ions and positive and negative deflections on our ECG tracing, really we're just talking about the flow of positive or negative current towards the lead. So what I'll start by outlining is when we're looking at the normal conduction system. So in this case, we're looking at normal non-impaired conduction. We can differentiate between repolarization and depolarization on the ECG based on the flow of electrical current. So we have to have a few baseline pieces of understanding here. We should know that during depolarization, we have the positive flow of current or the flow of positive current towards our lead. Or that when we're seeing positive deflections on an ECG, what we're seeing is the flow of positive current towards our lead. So typically when we're seeing, for a good example is, positive deflections in our QRS complex on an ECG, what that positive deflection is representing is the flow of positive current towards the lead. So for example, what we're seeing here, when we see the positive deflection of the QRS complex, that is being represented by the positive flow of ions towards the lead, or the positive flow of current towards the lead. To make that make a little bit more sense, we know when we're seeing depolarization, what we're seeing is sodium entering the cells, creating a more positive environment. And this is what I mean by positive current. And we're watching that occur down through the conduction system, through the myocardium, towards, and if that's happening towards a lead, then we get a positive deflection. So the flow of positive current towards a lead will cause a positive deflection. The opposite is true when we see the flow of current or positive current away from a lead. So the flow of positive current away from a lead will cause a negative deflection. So we'll outline those pieces here. Now, when we talk about repolarization, we have to remember that we're talking about the negative flow of current. So during repolarization, what we're seeing is as the ventricle is repolarizing, we're watching the tissues become more negative. We can draw this in as we look at our myocardial action potential, where we see the action potential occurring, and then we have repolarization of the tissues. Again, what we're seeing in this phase of the action potential, which is characterized by the QRS complex, what we're watching is depolarization, or the cell and tissue becoming more positive. So that's what we mean by positive current. When we look at this part of our complex, what we're seeing is those tissues becoming more negative as we're repolarizing. So the green would represent the positive flow of current, while the pink here would represent the negative flow of current. So depolarization, again, represented by positive flow of current, while the pink here is repolarization. It's going to be recognized by the negative flow of current. So when we look at why is our T wave commonly positively deflected, this has to do with the fact that it is represented by negative current, and that negative current is flowing away from our lead. So when negative current flows away from our lead, so again, I'm going to use pink here to represent this. So as the ventricle is repolarizing, typically see the flow of negative current away from the lead that we're positioned at. And that's why we see a positive deflection in our T wave. This is represented by potassium exiting the cell in an attempt to make things more negative. So we're seeing repolarization. So we have the negative flow of current away from the lead, and that will create a positive deflection. So when I have the negative flow of current away from the lead, so negative current away from the lead, that creates a positive deflection. If I were to have the negative flow of current towards the lead, this would cause a negative deflection. So the reverse is true when we're looking at depolarization versus repolarization. When I'm looking at the flow of positive current, the flow of positive current towards the lead results in a positive deflection. The opposite would be true if that current was flowing away from the lead, it would cause a negative deflection. When I'm looking at the flow of negative current or repolarization, the flow of negative current away from the lead leads to a positive deflection, where if I had the flow of negative current towards the lead, that would lead to a negative deflection. So again, in pink here, that flow of negative current away from the lead is what's causing the positive deflection. Now, the reason that we have the flow of negative current away from the lead here is because the epicardial tissue is going to repolarize quicker than the subepicardial tissue. The flow is occurring in this direction because this epicardial tissue is repolarizing at a faster rate than the subepicardial tissue. So we watch repolarization basically go from the outside of the heart to the inside. So that's why we get this negative flow inwards. So we'll outline some of these pieces here. We know when we have negative or repolarization current, the flow towards the lead causes a negative deflection, while the flow away from the lead causes a positive deflection. And we also know that we see an inward, or we get inward repolarization because the epicardial tissue repolarizes faster than the subepicardial tissue. So often when we're looking at ischemia resulting in T-wave inversion, it's going to be because of the subendocardial damage to the ventricle. So what's happening is we have damage or ischemia to the tissues in the subendocardial portion of the heart here. So we see damage and ischemia to these areas. And we know that this can often be associated with T-wave inversion, so we'll draw that in here as well. So what this would mean to us, if we think about everything we've talked about so far, a T-wave inversion would be the result of negative current flow towards the camera rather than away. So what must be happening here is instead of the epicardial tissue repolarizing first and then progressing towards the subendocardial tissue, we must be seeing a reversal of that effect. So the subepicardial tissues, or our endocardium and myocardium, are repolarizing first, followed by the epicardium, which would lead to a net flow or a net negative flow of current towards the camera. And that is, in fact, what is happening when someone is having ischemia or damage at the subendocardial level. Because the tissue in the subendocardium is damaged, so this ischemic tissue here is damaged, it actually will repolarize faster. So because we have that ischemic tissue, we start to see faster repolarization. What this means is this tissue is going to repolarize at a faster rate than the epicardial tissue, and what we end up having is a net flow of negative current towards the epicardium. So because the subendocardial tissue is repolarizing faster, we get a net flow of electrical current, a negative electrical current towards the lead. Because ischemic tissue repolarizes faster than the epicardial tissue, we have net negative flow towards the lead. So net negative flow towards the lead. And that is what is going to be causing the T-wave inversion. So we get this net negative flow towards the lead. So we can see a couple of examples here of T-wave inversion. One is going to be when we have acute ongoing ischemia. One is going to be represented by the post-ischemic event, or potentially occurring following an ischemic event. In the acute event, what we're typically seeing here is ST depression. So we see some ST depression followed by T-wave inversion, which is indicating to us that we have some subendocardial damage, and I can link to another video on ST depression here. So we have some ST depression as well as the inversion of the T-wave, which is indicating to us the ST depression is highly indicative that we would likely have some ischemia going on, and then a T-wave inversion is supporting evidence of that. So again, if we think back to why that is the cause, so why would I have this T-wave inversion, then the reason for that is going to be because I see a net negative flow away from the lead. Again, what's interesting about T-wave inversion is that it's not often highly specific for ischemia. So what is supportive here of the T-wave inversion to let us know that this is likely an ischemic event is the ST depression. And the reason for that is because when we have ST depression, that's telling us often that what's happening is we have the positive flow of positive charge towards lead here. And what that would indicate is, again, shows up on the ECG as a ST depression. What we have alternatively here is post-ischemic T-wave inversion. So people who have previously had infarction or ischemia can end up with T-wave inversion because this damaged tissue remains. So in these cases, you can see we don't see any ST depression here. We do simply have some T-wave inversion. And again, that's indicated or indicative of damage to that subendocardial tissue, which is promoting the reversal of our repolarization flow. So repolarization is flowing towards the lead rather than away from the lead. And again, that's because damaged tissue will have a faster repolarization phase, which will mean that it repolarizes faster than the epicardial tissue. So the net flow is directed inwards rather than our normal event where the epicardium repolarizes quicker and we have net flow of negative charge towards the endocardium or the subepicardial tissues. Again, what's prominent about this is that we have no ST depression. So again, when we see T-wave inversion like this, it could be indicative of basically old damage and is not highly specific to current ischemia. That being said, there are lots of different causes of T-wave inversion, and we have to keep that in mind. One thing that we should be aware of is if someone's presenting clinically with symptoms of cardiac ischemia, and we see both ST depression and T-wave inversion, then it can increase our index of suspicion of cardiac ischemia for that patient.